Good afternoon and welcome. Thank you all for being here for our September session of the Arizona Community Grand Rounds. We are excited to launch our fall sessions after our summer break with a wonderful topic and expert speakers here today. I'm Carla Berg with Blue Cross Blue Shield of Arizona, and I'm so excited to dive into this session titled First Place, the Power and Perpetuation of Supportive Development for People with Autism and/or Intellectual and Developmental Disabilities, or referred to here as AIDD. Before I introduce our wonderful speakers, I'd like to extend a thank you to our partner, the NARBA Institute, for being instrumental in making the Arizona Community Grand Rounds possible, and to Mary Jo Gregory, Dr. Mark Carroll, Jessica Rigler, and Jennifer Pierce for their work in bringing the series together. Now, it's my pleasure to introduce our speaker panel, and I will share a brief summary of their very impressive bios. I would like to welcome Denise Resnik. Denise is the founder and president CEO of First Place Arizona, established in 2012. She's co-founder and emeritus board member of the Southwest Autism Research and Resource Center, SARC, and founder and CEO of DRA Collective Marketing and Communications Firm. And she will say, likely above all else, she's Matt's mom. Denise currently serves as a member of the ASU Foundation Board and the Watts College Dean's Council, the Creighton University Presidential Health Services Phoenix Advisory Board, the Precisionist Advisory Board, and Home Matters to Arizona. She also serves as a federally appointed member of the NIH Interagency Autism Coordinating Committee. Denise received her Bachelor of Science in Business Administration from ASU, and just last year was awarded Arizona History Maker and was named to the Arizona Women's Hall of Fame. Next, I'd like to welcome Maureen Casey. Maureen is the Chief Impact Officer at First Place Arizona, where she leads movement to advance housing, healthcare, and community development for adults with AIDD through research, policy, funding, and special community building projects. Maureen's efforts with First Place Arizona and the Global Institute include publication of housing market analyses across North America to identify key recommendations and to fuel a marketplace of housing and community development. Maureen previously served in key leadership roles in Arizona state government at the Department of Economic Security, including senior advisor to the director, assistant director for the Division of Developmental Disabilities, and key roles in the Division of Child and Family Engagement and the Arizona Early Intervention Program, where she led the successful implementation of team-based early intervention services. Maureen received her Bachelor of Arts from Marist College and a Master of Arts in Comparative Politics from Fordham University. Next, I'll just note our speakers. No individuals in control of the educational content here today have any relevant financial relationships. Now I will move to the highlight of our series here today, session here today, which is our presentation. After, if there is time, we will be able to accept questions. At that time, you can use the Q&A function to send questions our way. All right, Maureen,
wonderful.
Denise and Maureen, the floor is yours.
Thank you so much for that introduction, and to our friends at Blue Cross Blue Shield and the NARBA Institute for having us. This is a great opportunity for us to share what's happening here in Arizona as we fuel a new wave of housing and community options for people with autism and intellectual and developmental disabilities. And I am trying to share right now, but somebody else's screen might have popped up, so bear with me for just a minute. I'm going to try that again. Okay, a little technical difficulty.
Here, Denise, you want me to?
You know what? I've got it now. Thanks, Maureen. My apologies. I do want to acknowledge, as you recognized us, that yes, I am Matt's mom, and that's what brings me to this important work. Matt is a man with autism living at this property called First Place Phoenix, right in the heart of the urban area. And through a mother's heart and as a community developer, recognize that people don't just live in four walls, they live in our community, and we need to create a supportive community. So what you're going to learn about today is First Place Phoenix and our Global Leadership Institute and how we're leveraging that power of an example to get after system change. And recognizing that we as a charitable nonprofit can't do it all ourselves, why it's so important for us to collaborate with the private sector, with the social capital, for the charitable sector, and certainly through the public sector. And it's one thing to be a beautiful property, but we need data. We need to understand what's working and for whom and what needs to work better and how this connects to our broader community and how we create these important crosswalks in terms of how we pay for what can be very expensive in terms of caring for people who need supportive housing. And of course, what we love to do is scaffold all these strategies for greater impact, not only locally, but nationally and globally. Matt was diagnosed with autism over 30 years ago, and the incidence of autism was 1 in 2,500. 1 in 2,500 children were being diagnosed. Today, the rate is 1 in 38. And when you think about what's happening to kids with autism that are growing into adulthood, we are seeing more adults at an unprecedented rate transitioning. That there are more than 110,000 transitioning to adulthood every year. And when that school bus stops coming, oftentimes so do the supports. Introduced to a life that is often disjointed, where aging parents like me, unable to care for their adult children with autism, are finding that it's too much. And so unfortunately, Maureen and I and the team at First Place receive far too many calls of people who are being displaced or who are homeless. And so we often feel that when we get it right for people with autism and intellectual developmental disabilities, we get it right for a lot of people, not only in their housing and their connected communities, but in their places of employment and their purposeful days and their healthcare and their education and their training and feeling included and belonging. It didn't just happen. This has been happening over decades. Early on, we started the Southwest Autism Research and Resource Center that dates back to 1997. But within 2 years, we're already advancing plans for housing. Quite frankly, it was because I went to those places. We were told to institutionalize our son and committed that we were going to find a better way and did that with friends, with colleagues, with clients at the time through my marketing and communications firm so that we could figure out what we could do in our community and also for the industry. And so for the next 10 years, from 99 to 2009, we evaluated more than 100 properties across the country because we were sure we were going to bring the model back here to Phoenix, Arizona. And we found some really good things and we published those findings with ASU in 2009 called Opening Doors, setting forth 10 design goals and guidelines. But we didn't find what we were looking for, something that was truly scalable and replicable and financially and operationally sustainable. So that's where we set our sights. And that's what is First Place. I have to admit that through all the years, we didn't anticipate a pandemic, but we got through that. And we did so as a separate nonprofit from SARC. In 2012, in this timeline, you can see that we created a separate entity to focus in on housing and community development, requiring a much different risk tolerance than SARC. And through the years that followed, you're going to see more models, more examples, and more data collection and more study. And that brings us to our current space where we are not only creating First Place and helping inform other places as sustainable, replicable, scalable properties, but better understanding what works well for people like our son, Matthew, and for others. And so for us, it's a big vision proposition, but you can't do it all at once. To truly ensure that housing and community options are as bountiful for this population as they are for everyone else. And we can only do that through creating supportive communities where people with autism and neurodiversities live and thrive, as we like to say, with pride, purpose, and endless possibilities. And it requires a lot of practice. It requires a lot of practice and opportunities to learn in a reciprocal way from our residents at First Place as they're learning about their next steps, along with their parents and their caregivers. And the number one reason why people want to live at First Place is they're looking for friends. And right after that, they're looking for jobs and they're looking to build those independent living skills. And if you think about what we're doing, it's in reverse to senior housing. You know, in senior housing, you think about independent living and then semi-skilled in nursing. Well, we are not a nursing property. We are, however, providing more intense supports early in adult life to increase that level of independence to the greatest degree possible, increase quality of life, and we're demonstrating that with outcomes, and create more options for where people may live next. And over their lifetimes, and really within the first few years, able to reduce costs for how and the kind of support that's needed. And so we do that in three ways, as we describe First Place as a mix of uses. We have apartments, that's supportive housing, and that's for residents, and fair housing rules a day, because this is not a licensed property. It was actually created to be as close to the marketplace as possible so people could have more choice. We also created a Transition Academy, which is a 2-year program. Our clinical collaborators in that program are SARC, the Southwest Autism Research and Resource Center. And the third space is our Global Leadership Institute, which is truly our catalyst to create more options and to collaborate with people across the country and globally. When our architects learned of all this work that we had done and all the programming and all the visioning, they introduced this beautiful piece of art. It's called kintsugi. And what they wanted us to do through this kintsugi art is think about how the artist smashes the pottery and then brings it back together with this precious metal, with the gold resin. And they wanted us to not start with our three uses, but to think about community development, to think about the community that we were developing in this way of kintsugi. What would bring the pieces together? What would we design to bring the residents out of their homes together with the Transition Academy participants? Where would they find their opportunities to socialize and share those common interests and make their friends? And then how would those two interests every day inform where we go next with the Global Leadership Institute? And then what we do to create this collective memory is truly what builds community. And people are living at the First Place community because it is situated right in the heart of the greater Phoenix area, also known as the most autism-friendly city in the world. And so we describe First Place as a consumer-controlled property. And this represents a few pages from our 2020 publication in collaboration with the ASU Morrison Institute called A Place in the World. Because what we realized is that from all the sectors, we weren't speaking the same language. And so what we did is to create language that recognizes high support needs, moderate support needs, low support needs, recognize what's a provider-controlled property versus what is a consumer-controlled property, and to help us better segment the market. Just as my being a senior doesn't tell you what I want in my housing, neither does somebody's autism or Down syndrome or whatever condition they might have. That publication actually profiles several properties from across the country, and it is also being used for research, which we'll talk about soon. Within the apartments, people receive all kinds of support, and this is how we're building those skills and how we're also learning how to connect to the community. And we start with the person in mind. So again, it's opportunities to design their life at First Place based on what they need, because we know we can't learn everything at once. And we know that unless people have their home and that stability, they're not going to be able to take their medication or remember to take their medication to find a job, to make their friends. So really helping them be the best they can to build their full life. We also do this through our Transition Academy, which is, again, this 2-year, more structured program. We have a collection of curricula that we have developed over the years. It is 32 semester-length courses, and you see all these really important topics that people need to learn how to be an adult and care better for themselves. Those little dots, those little green dots represent the number of semesters that the courses are taught. And so you can see over the 4 years, they're getting something about work every year, and finance and safety and relationships and community. And you can also see many of the other important topics that not only people with autism and intellectual developmental disabilities need, but I would say all kids and young adults need today. Through the years, we've collected a lot of data. This slide reflects on one of our more recent graduating classes, where 94% learn how to navigate their transportation by the end of their 2 years. They've 90% setting goals, 90% taking care of themselves, 70% employed. And keep in mind, for this population, specifically for autism, the unemployment rate is 86%. And so we're demonstrating how we create healthier paths for where and how people live their lives. And we bring that data together through the Global Leadership Institute, along with leaders from everywhere. And we do that through these 5 centers. Our first center is the Maricopa County IDA Center for Education, Training, and Employment, where we have a lofty goal of creating 1,000 jobs for people in this space by 2030, and we're gaining on it, recognizing how we're adding to the fabric of our community and our economy. And this requires a lot of work and practice with our own residents and also the broader community. So for us, as a property that can house about 70 residents, please understand that we fashion ourselves not only as a residential developer that has developed, in addition to First Place, 2 affordable housing properties in collaboration with the Foundation for Senior Living, but also as a community developer, so that we create these important connector spaces within our community. The curriculum that we shared is also been licensed by 18 organizations across the country, now including Canada. We are helping people on their paths to employment through making sure that they're ready to work, and that doesn't just happen. Getting up, getting ready in the morning, being on time, also understanding all those environmental supports that they might need beyond the work or the job task. We also recognize how we're learning how to support ourselves, and have developed a body of training curriculum for adults with autism and intellectual developmental disabilities called Place for Peers. And we're very excited to be piloting that soon as we continue to model, to pilot, to demonstrate, to collect data, to recognize opportunities for improvement, as we then push things out in terms of our curricula, our toolkit, our data, and how we continue through not only our space of curricula, but also through some creative. And this is a campaign that we have launched and that you'll see more about this fall and in the years to come, called Be Open.
If you're an Arizona employer, it's time to be open to new solutions.
Be open to motivated employees.
Be open to hard workers.
Be open to loyalty.
Be open to attention to detail.
Be open to pride in the workplace.
Because if you can be open to employing an autistic and differently abled workforce, you can be open to more business.
Be Open Arizona. Learn more at beopenarizona.org.
And because we do dream big, we've not only, reserved the URL, beopenarizona.org, but beopenamerica.org. And we have people from across the country who have seen this and who are also very interested. But we also appreciate that. I think you were going to allow me to share my screen again, or do I need to do that? Hold on a second.
You should be able to pull it up and share again.
Okay, great. Thank you. But before we're able to share all this out nationally, we have to demonstrate it in our own backyard. And again, when you dream big like we do, we want to be able to. I already warned others today that technology is not always my strength. So please hold for just another moment. Denise. Thank you. But before we can push things out nationally, we have to make sure that they're working. And that's really important for us, is to make sure that we have the efficacy. And we know that we're not going to advance public policy here from Arizona that at a federal basis, only from Arizona. We have to work with our collaborators. And that's what we focus on, is how we bring the broader community together nationally to focus on these boulders that are standing in our way. Okay, am I sharing yet?
Not yet. It doesn't look like it's coming through.
Okay, hold on. Thanks. Now am I sharing? Okay.
Yes. Perfect.
Thank you. Our second center is the Make Way Center for Community Development, bringing us these opportunities of creative and how we think about creative, along with technology, that are major connector spaces for us. For us with the Make Waves Center, it is about how it's creative, but it's also solving problems for the bigger issue. I talked about nomenclature earlier, and if we don't speak the same language, how do we know what needs to be developed, and how can we test it and really build those benchmarks that are required for an industry? It's about building our foundation, and love nothing more than to do that in our own backyard, as I am a native Phoenician, and think of ourselves as an economic and community developer, as well as the residential developer. The properties that have been featured in that Place in the World report, which again promotes 150 terms that we have identified for not only the housing, but also about the kind of support that people need, along with individuals, in terms of what they might be looking for in terms of lifestyle, because we don't all live in the same place, and we can't develop all a one-size-fits-all approach. And truly, at the beginning of this journey, I thought we could develop something for people with high support needs and low support needs, people who could afford, who couldn't afford, but there is not a one-size-fits-all. So our approach is, how do we develop a marketplace? And we can only do that by having these models, by having these proof points, by having the data. And so we have now packaged that through our housing market analysis. And Maureen, if I could ask you to weigh in, because there's a lot of excitement around the housing market analyses and how we're taking those recommendations and conclusions locally in Arizona, but also now nationally.
Thanks, Denise. Yeah, so taking those 150 terms, what we've done is create educational presentations, because if all you know is living in the home that you've grown up in, or the possibility of a group home or adult foster care, this idea of having a marketplace of housing seems really daunting. So what we've done is taken it and made it really simple. We educate self-advocates and their families, talking about types of housing and supports and amenities that someone might want in their housing. And we break out then what's the benefits, what's the consideration? Because living in consumer controlled housing might be what you want to do, but you need to understand that if it's consumer controlled, you have certain responsibilities and you need to be able to uphold those responsibilities. That's different from being in a provider controlled home, like a group home or adult foster care, where those responsibilities are removed from you. But that also might limit some of your choices in how you want to conduct yourself in your home. So we explain that, and then, only then, do we ask people to help us to understand what they need and prefer in their future housing. So we've done that in almost 9 communities across the country. And what's been interesting is each community has their own unique themes, the way that their housing is set up, their housing vouchers, their zoning might be different, their Medicaid waiver, the way that they've structured their home and community-based services. But there are themes. There are themes that are coming through across each of these communities that we're able to then pull together to help us to advance some systems change that is desperately needed. Because as we think of the housing crisis we're all experiencing, that housing crisis is only broader and deeper and more difficult for the population that we are called to serve.
Thanks, Maureen. And so as you can appreciate with these housing market analysis, and by the way, there's an interest from 20 more markets beyond what you're seeing on the screen. You think about how we're braiding together local leaders, local stakeholders, activating their local marketplaces. That's how we fuel a new wave of housing and community development. And these are organizations who are not only committed to the home and to the residential property, but also to building out their community. And that, again, gives us great pleasure and joy to think about how we shine this very bright light on our state, and also consider how we join with other organizations to develop, co-develop new models. Our interest is in having a portfolio of properties, about 10 by 2030. And it could range in terms of what they're called. They don't all have to be first place named properties, because we really want to lean in to those local leaders, those local organizations that know their local jurisdictions, their policymakers, their philanthropists, and recognize, again, the impact of what we can do together that we cannot do alone. And as I mentioned, with our own Phoenix housing market analysis, it's being leaders here. It's making sure that we work on those recommendations and add 100 new housing units with supportive amenities by 2028. We're holding ourselves accountable. And that's one of the ways we lead. We do not claim to be the smartest people in the room, but we're really good about getting really smart people there. And we're doing a lot of that through the Colonel Harlan Sanders Center. And Maureen, if I could ask you to go ahead and lead us through this.
Sure. And we're going to go deeper into the Health Starts at Home. So I'll just give you a brief on Health Starts at Home, but really researching both the challenges and the opportunities to ensuring high quality, compassionate medical care for adults with autism, intellectual, and developmental disabilities. What we know is that a lot of focus over the last 2 decades has been brought to bear on pediatric services and early intervention and early identification. What we've neglected, though, is to think about how autistic children and youth grow up to be adults. People with Down syndrome become adults. And so how do we address the challenges that they're experiencing in the adult healthcare system? And I'll talk more about that in a couple of slides. But we're also looking at that because healthcare is also community development, and thinking about these community properties that Denise described, the 100 properties that she saw, how can we demonstrate that this different way, these innovations that people are undertaking are having better outcomes? So we've brought together housing and community developers, universities, and other interested parties to really explore what is working, what needs to work better for these properties, and then how do we demonstrate through translational research the impact of these types of properties and how we can scale and sustain them. So we're really excited that with funding from our friends at Blue Cross Blue Shield, we are embarking just this summer with IRB approval, a series with Rutgers University to look at 4 specific properties. These properties have different approaches across them. And what we're going to look at is the impact to that individual who's moved onto that property, their family members, extended family, as well as the staff, so that we can tease out the economic, quality of life, and impacts that we're having with these properties. So really excited, and we're thankful for the sponsorship.
And we also appreciate what this means in terms of making ourselves competitive for national grant opportunities and recognizing the platform that we're creating, how we're practicing working together and aligning platforms for data collection so we can do more and test more. And then we have our Molzet Center for Expression, again, where a lot of creative happens together with our Make Wave Center, and where we're, creating campaigns like what you saw from Be Open, Be Ready, how we're amplifying our voices here, and certainly, and importantly, the voices of the people who live with autism and who have autism and other disabilities. And we've got some amazing talent, amazing artists. We'll be featuring them at our Global Leadership Institute next month, and we'll share more with you about that at the end of the presentation. And finally, we have the Daniel Jordan Fiddle Foundation Center for Public Policy. And this is where we bring it all together for systems change. Maureen, you want to share a few points about the center?
This center is really focused on autistic adults. We've expanded as well to look at those with intellectual and developmental disabilities. We are proud to have funding for a fellow at Arizona State University's Watts College of Public Policy. And that's enabled us to do some deep dives into public policy and to think about the research that we've brought to bear with the Colonel Harlan Sanders Center, and then what are those levers of public policy that we might need to move? Which really brings us into the next section, which is health starts at home. We know, and you know, right, that the work that that physicians do really only accounts to a very small percentage of our own health. So how do we think about our home and how health starts at home, and how it specifically starts at home for individuals with intellectual and developmental disabilities, right? And so that's starting with how we teach people how to cook and care for themselves, to think about nutrition, to exercise regularly, to manage what's happening in their brain and their body, and then how they engage in social activities. So we've embarked on a series of activities that we've been piloting over the last couple of years, because what we know is needed is a healthcare equity model where better treatment approach, where no one goes untreated or is medically misunderstood because of their autism or other neurodiversities in Arizona and beyond. So that's a lofty goal. So how do we break that apart? And one way is through our Virginia G. Piper Health Spot. So we have a small health spot, a little clinic right here at First Place Phoenix. And what we have then through that is a physician that is here for 4 hours a week. And it's amazing what we've been able to pilot just with that little health clinic. So that health spot has enabled us to have access to protected time with a physician weekly, where established patients can make an appointment or just stop by. That is really important, because what we know about individuals with autism and intellectual and developmental disabilities is, while it might be difficult to get through a phone tree for all of us, it is really difficult when you have executive functioning challenges. So their brain is still focused on press 1 for this, but the recording has gone to press 6. Navigating, then thinking about what's on their calendar and what's coming at them from the receptionist can be difficult. So having this protected time of access is really important to get that just-in-time care from their physician. It also creates an opportunity for education. So our patients have benefited from that education, because if they're taking a new medication, yeah, their pharmacist can go over that new medication, but having that opportunity to check in weekly for a bit, to talk to their physician about what's changing in their body as a result of that medication, or to ensure that they understand how to take it, has been really beneficial. This also enables us to have students from Creighton University, both medical students as well as occupational therapy and pharmacy and physical therapy students there to experience that. And that learning has also helped us to really appreciate the challenges that we all have because the business of healthcare presents it for each of us, right? So having protected time isn't something that is necessarily available in insurance, but we've been able to demonstrate that it can have better outcomes. And so we can think about that. We can also think about the caseloads that our physician has in their regular job. So thinking about that has been really important too as we chart a course for the future.
And I'm going to go ahead and I'm going to try to show this. So I'm going to do this one. It might be easier than having me reshare my screen, if that's okay. So this is a brief video that we're going to share demonstrating some of what we do in this space. Staying healthy is essential to an independent life, and there are many ways for us to do that. Eat a balanced diet, get regular exercise, and always get a good night's sleep. Want to know one more way? Make an appointment to see your primary care physician for an annual physical. Here's why. During a physical exam, your doctor will check and discuss things that are vital to staying healthy and independent. You'll want to be ready for that discussion and questions your doctor may ask. To prepare, complete the annual exam preparation worksheet in your Peace of Mind portfolio. You can do this ahead of time in your home where you are most comfortable. The worksheet can help you identify questions your doctor will probably ask and help you think about your answers. You can also think about questions you want to ask. Bring the worksheet with you to your appointment so you can be prepared to share them with the nurse or doctor. The more information you can provide, the better care you can receive. One important note, during your appointment, you'll want to be as comfortable and calm as possible. So while you're accessing your Peace of Mind portfolio, complete the accommodations worksheet too. This will help the doctor staff know what will make you most comfortable during your appointment, like where you want to wait before your exam, or if you want to wear headphones, like the accommodations you had in school. They can help you concentrate and fully participate in your appointment. Expect the exam to be thorough and thoughtful. Your doctor will check everything that plays a role in living a healthy life, like your lungs and how well you're breathing.
Just a big deep breathing for me.
Your heartbeat.
Listen to your heart.
Your eyes and ears.
For me, please.
Your digestive system, including your stomach, maybe your skin. Find out ahead of time if your doctor will need to do lab work, which includes drawing blood from your arm. Your doctor will also talk to you about how you're feeling and whether you're anxious or depressed. It's important to be open and honest with your doctor about all of this. Your annual physical is also a great time to discuss vaccines. Which ones do you need? You may have more questions about other areas of your health. That's good. If something has been bothering you or if you have concerns, now is the time to talk to your doctor. So choose a month that works best for you. Make that the month you see your doctor every year. Remember, living an independent life means taking charge of your own health, and that includes adding your physical exam to the list of healthy things you do.
Thanks for sharing that, Denise. And so what you saw in that video was ways that we've developed worksheets to assist people to prepare, but also thinking about that environment. And I'll talk about that in just a minute. We've also launched, in collaboration with Creighton University, a fourth-year medical school rotation at First Place called Minding the Gap. And that rotation includes 4 components. So we've got that clinical component of observing, interviewing, and charting a treatment plan. as well as the community-based approach of observing and experiencing school and intervention programs, so that that med student really gets a full picture of how engagement with people with developmental disabilities really does require engagement with school systems and the Division of Developmental Disabilities and all of this other programming that often that family is really privy to, but doesn't necessarily cross over to physicians. So we want them to have a good understanding of everything that's come before to get that person to adulthood. And then we have them partner with a resident at first place. They work on a goal that's important to that resident, but to get to have a deep relationship over 4 weeks with an individual who's living with autism or other intellectual and developmental disabilities. And from that, we ask them to write a paper. Their paper needs to be an academic paper, but then we also ask for a plain language one, which then can go back and be supportive of our residents. Very often, those papers come out of that partnering experience that they have with our residents. So this year, the individuals focused on psychiatry and really thinking about portrayals of autistic adults in media. We are so proud of our collaborators from the Arizona Autism Charter School, the Arizona Autism United, New Way Academy, SARC, Dignity Health, Phoenix Children's Hospital. And so these are some of the sites where folks go on that rotation. So in that video, you got to see our 360 health and wellness curriculum. What's great about that curriculum is it starts first with that individual, that adult that's making that transition to adulthood, where we really help them to understand how the accommodations that they've probably grown to love and appreciate in school can be applied in their physician's office. You saw the young man wearing the headphones, right? Well, when he uses those headphones, that helps him to actually attend. So while we think of neurotypicals when they're using headphones that they're not paying attention, for autistic adults, what we know to be true is that there's often so much stimuli that having something in one ear allows their brain to focus a little bit off to the side, and then they can fully attend to what's being presented in front of them. So what might seem to us as neurotypicals as being not attention focused is actually attention focused. And so we go through in this curriculum, we help them to understand how to identify their accommodations. But we also work separately with their families and support providers. It's really important to help families who have been the person who knows everything about their youth or young adult, to help them to move from being the caregiver to being the advocate to moving to the side and allowing that adult to take over while still presenting a safety net for them. And to think about all of the other programming and supports that might be available. And finally, we have 10 modules called Implementing Care for physicians and other healthcare providers that help people to think about how you might take what works at Applebee's, right? That we just give you that thing and you go wait outside and we buzz you. How could we use that for autistic individuals so that they're not pacing in the waiting room and being seen as disruptive, where hey, maybe if they wait outside the waiting room, they'll actually have less anxiety and be ready for their appointment. And this is done through listening to folks. And we are so appreciative to the NARBA Institute for funding us this last year for some statewide listening sessions. And so what we did was fan out across the state to look at what does high quality healthcare for people with AIDD look like. So what does that identification of adults with high support needs, screening, diagnosis, and treatment look like? What does prevention for those individuals look like? What happens when they have an emergency or a crisis? And then how can we provide stabilization services? So we brought together autistic adults, folks with healthcare experience to help us frame some questions, and then we fanned out across the state. So we had 3 participating groups in each listening session. So we broke up adults with autism and their families and advocates into one group, healthcare and home and community-based service providers into a second, and finally, systems professionals, folks from DDD, managed care organizations, and other administrators to answer some questions. We went to Flagstaff, to Tucson, to Phoenix, and then we held a virtual session. And we heard some incredible things. We also had a graphic recorder to capture the information in a plain language format. And so that helped us to really see the themes across these areas. So very similar to the kind of work we did with our housing market systems, where we asked them what would make the perfect system for high quality healthcare. And then they identified top 3 areas. So for this group in Flagstaff, they wanted a national EHR database, effective communication, and provider education and training. For the folks in Tucson, they really were focused in on busting silos. So there was a lot of conversation about the difficulty of moving between the healthcare system for physical health and behavioral health. And so this idea that some folks with an autism diagnosis might get to adulthood, might even get through college, but because they lack certain systems, that they might end up needing high behavioral health services and have difficulty getting back into the system. They talked about just the need for training for staff and family caregivers, including insurance and healthcare providers. More on that in a moment. And access to consistent on-ramps as individuals age. Again, more on that. In Phoenix, the team really focused on the fact that the Governor Ducey's access team had held a series of meetings around improving access to care for autistic individuals. But that focus really focused in very hard and appropriately on early identification and intervention for young children, and sort of parking lotted the idea of what happens to youth and adults. And so this group really said, we need to focus in on what happens between 16 to 25. We also need to increase access to behavioral health using transportation and technology, and again, education. And this idea of that within that education, we need loan forgiveness and other incentives, that if we're going to ask people to have more focus on the needs of AIDD adults, we have to recognize that and we have to pay for it. So what's really excited was the Blue Cross Blue Shield team was part of those listening sessions and came to us and said, hey, we have an idea for a community of practice. And with 2 prongs that really, as you see, really build on what those listening sessions had to say. One was continuing medical education with a series of courses to support provision of care to ASD adults. And the second is on case management for transition-aged youth with ASD. So what do we need to provide as that case management? Thinking about it in terms similar to what happens in diabetes care. So that initial diagnosis and that acute care, but applying this to the initial turning 18 and preparing for that, or somebody who might be in crisis. So very responsive to the listening sessions. And I would be remiss if I didn't thank all of our generous sponsors for all of our healthcare work. So Blue Cross Blue Shield Arizona, the NARBA Institute, Stardust Foundation, the Make Waves Family Foundation, Dignity Health, Nita and Phil Francis Family Foundation, and the Jonathan and Elisa Pincus Charitable Fund. Because each of those have helped us to identify and pilot things, and then to help us to think about charting a course for the future.
Thanks, Maureen, and grateful, so grateful for all your leadership in this space. Very importantly, by way of history, we have forever been looking at this population of people with disabilities, people with autism, and truly when we start looking up and out, we see opportunities where we can affect more, and we can be at the table when we solve problems like the housing crisis, that our population needs to be represented with the other populations who are experiencing homelessness or who have challenges with healthcare or where there are obstacles in terms of accommodations in the workplace. So all these things are really important. And we know that in our charitable nonprofit space, we have a role to play. And thanks to the 1993 Voter Registration Act, our role to play is in being able to register people to vote in a nonpartisan way. We recognize that there is so much good that can be done in the policy space and can be undone. And we've worked so hard to get it right. So it's very important for us in this election year and in all election years to have a voice and to have a seat at the table and to make sure that when we talk about a spectrum, we are recognizing a spectrum of autism, a spectrum of disabilities, and that spectrum between red and blue, and that when we get it in the middle, we get it right for just about everyone. And so we have launched this initiative. We have a website that you can learn more about at votethespectrum.org. It includes a toolkit of ways to activate and share through social media, reminding people that this is our time, this is our superpower, that no matter who gets elected, we need to make sure that they have our backs. And here's a brief film to share from a few prominent Arizonans, R's, D's, and independents, what they have to say about how we create a more perfect union.
In order to form a more perfect union, we need everybody to participate in the process.
We have to nurture an inclusive culture, one that values everyone.
And I do mean everyone.
Including those on the autism spectrum and the entire disability spectrum,
who sometimes don't have the kinds of benefits that many of us enjoy.
Those people who are on the spectrum, they have a tremendous amount to contribute
because they have the capacity and desire to be part of this society and be productive.
We are better when everyone has a piece of the country and a piece of the American dream.
Diversity of ideas, opinions, perspective, and a diversity of people.
We need to do everything we can today to encourage more people to be involved, more people to understand what's going on around them and us, and more people to ultimately
get involved by registering to vote and actually participating in elections.
It is very important that we get out and vote with thoughtfulness, with kindness, and humility.
Voting, which I do every single time, is not only a right, it is a privilege and an honor.
Your voice matters and your vote matters.
Wherever your head, your heart take you, let the rest of you go with that.
That's how we're going to form a more perfect union.
Everyone should be engaged. Let's vote the spectrum.
If you don't vote, our democracy is surely in trouble.
And we encourage you this season and all seasons to vote, to encourage others, for people who you know who have autism or intellectual developmental disability. It's really important for them to know their rights too, as guardianship and privileges of guardianship, benefits of voting have changed. And so we will be hosting our third Spark the Spectrum voter registration workshop with other state leaders on September 16. We invite you to join us to learn more. We also invite you to join us for our 13th Global Leadership Institute Symposium, which will be here in Greater Phoenix, October 16th through the 18th. And you could also access that via Zoom. And again, we are stronger when we all work together. And this is a wonderful opportunity for us to share with you and for us to be able to continue to learn from you. Thank you very much for your support.
Thank you so much for the engaging presentation and the information. I think 54 minutes ago, we probably weren't as uplifted as we are now, and that's just a great way to lead through our session. We do have a few minutes for discussion. I wanted to encourage those participating to enter questions directly into the Q&A, but I'll also kick us off. You know, the historical snapshot that you shared through the decades is so impressive. and systems change, as we see, takes time. What are ways that you found that even through shifts such as the pandemic, what are ways that you really helped to maintain that momentum and to maintain that engagement? Or what were additional shifts maybe that weren't represented in the key milestones that you shared?
I appreciate the question. And maybe I can answer first and then kick it over to Maureen. But dreaming big in a way that's going to rally our community, of recognizing what can we do together that we cannot do alone, is really important. And that's it's a critical component. But we also appreciate that it doesn't happen all at once, and that when you dream big, you have to take steps along the way. And one of those steps, as an example, before we built this 81,000 square foot property behind me, was to work with the Foundation for Senior Living to work on a smaller property that could help us learn what would be required to operate such a property, and making sure that you understand the steps along the way. Maureen?
Yes, and I think thinking about when opportunities present themselves. So as we talked about, the listening sessions identified some concerns, opportunities, and challenges, but being prepared and ready when someone says, "Hey, I have an idea. I'd like to try it out and pilot it," and learning from the folks who are most impacted. We did our own COVID vaccine clinic here at First Place, and we did it humbly, and I have to say, totally humbly. We set it up. I knew all of the things because from having worked with some of you all at the Department of Health, and I had some of the residents say, "Maureen, if you want us to be distracted, we have to be able to see the movie on the TV." Because the health folks rearranged the room so that it was beneficial to them. But having that feedback and allowing for that feedback, and then saying, "Oh, you're right. And what else can we do?" And being told, "And you know what? Short videos would be best because we're only going to be in there shortly. So I don't want to get engrossed in the movie." So really doing that humble exploration, but being ready for the opportunities and seizing them.
Wonderful. One other question. So in the listening sessions, you shared common themes that came about from Tucson, Phoenix, Flagstaff, and virtually. Were there any aspects that were geographic specific that were surprises, or maybe that differed to mention and to call out as opportunities?
I think so what was different in some ways was that the approach in Tucson and Flagstaff, because there's less, there's fewer organizations and things like that, they've been able historically and continuing to figure things out differently. So one of the things that we saw a big premium on there was a lot of the students who came to the sessions were also engaged in home and community-based services. So we saw folks who might be pursuing a bachelor's or a master's or even a doctorate, but who were engaged in providing direct care work to individuals in that community, something that we're not seeing as much or hearing about as much in Phoenix. So I think that that's an opportunity for us to explore in the Phoenix area. How do we capture that need for income and our need for direct support workers? But I think also, how do we think about that career ladder for folks as well? Something that I think that the childcare community has done a little better than we have in direct service work.
And I would challenge us all to continue to think about that piece of kintsugi art of how we take the pieces, things that are working really well, and where do we add that gold resin? What will bring us together to create greater resilience, beauty, uniqueness, and as much as, again, the pandemic was, not something we expected or wanted, it sure tested every system. We never closed a day. And that is predictably the unpredictable world we live in.
what a great note to leave us on. I know we could engage for hours on topics, but we will absolutely share the campaign resources that you identified and that you shared with us in terms of supporting employment and how different individuals throughout our community can support that work, voices through voting, and healthcare professionals in their settings of ways that we can incorporate individuals' needs and preferences in seeking and receiving care. Thank you so much, Denise and Maureen, for joining us today. For those attending, stay tuned for a follow-up email to share our resources, including a recording of today's session. And we'd also want to announce and have you save the date for October 2nd, which is the next of our fall series, a timely conversation around respiratory viruses and updates on RSV, COVID-19, and flu vaccines. That session will be again from 12 to 1 p.m. Thank you again. We look forward to seeing you all then. Have a great afternoon.
Great. Thank you.
Thank you.